Good morning, everyone, and welcome to the 2026 Sickle Cell Disease Policy Forum, Voices to Action. I'm Ryan Hill, the founder and CEO of Indigo Hill Strategies, and I'm honored to serve as your host for today. We have an incredible program lined up for you all. Over the next few hours, you'll hear from advocates, policymakers, clinicians, and community members who are doing the real work of turning voices into action. Now it's my absolute pleasure to introduce someone who needs no introduction in the sickle cell community. She's the co-founder of Sickle, a fierce advocate, and the CEO leading this organization's incredible mission, Ashley Valentine. Ashley?
Great. Thank you, Ryan, for all of those great and kind words. And I always like to remind everyone, I'm just one piece of the puzzle. Sickle wouldn't be possible without our other co-founder, the late and great Marcus Valentine. So here we are again. We are at the 2026 Sickle Cell Disease Policy Forum. And good morning, everyone, and welcome. Thank you all for joining us. We're grateful for each and every one of you for being here today and for showing up with a commitment and the passion to advance education and awareness for sickle cell disease. Before we get started, I'd like to thank our sponsors for making this event possible. We wouldn't be able to do this without your support. We have a great agenda for you all today and some exciting news to share as well. This year's conference theme is Voices to Action, and that really plays off of last year, that your voice belongs. So I've said this many times, but it's worth saying again, your voice is your power and your story is your tool, and everyone should feel confident that their voice should be heard and that these voices are being used for actionable change for sickle cell disease. We consistently hear from members of Congress and their staff that the stories are what resonates the most with them and that the stories are what they remember. So as we gather here today, and as many of you prepare for the Hill meetings tomorrow, remember your voice matters and it also drives action. So on the sickle cell side and for the sickle cell disease community, yesterday was a historic day, a big day for us as a whole. We were proud to announce the relaunch of the bipartisan Sickle Cell Disease Caucus. The caucus will be led by Representative Glenn Ivey of Maryland and Representative Rich McCormick of Georgia. The caucus will focus on education and strengthening awareness around sickle cell disease in Congress and advocating for federal legislation. The caucus also needs all of your support because the caucus represents the people. So it really will be our job to educate our members of Congress why it's important to join the caucus and why sickle cell does impact them, because you're their constituents too. So without further ado, I'd like to introduce our keynote speaker, Maya Lang, our Chief Policy Officer here at Sickle. So some of you know Maya from when she was on the government side, and we are so incredibly grateful and excited to have her here leading Sickle's policy and government affairs work. Maya brings a unique combination of professional expertise and personal experience that is invaluable to advancing our mission. She joined the team last August, and she hit the ground running, leading the development and the implementation of our government affairs policy and our policy strategy. Maya has over 25 years of experience in both public and private sector, including roles at the U.S. Department of Health and Human Services, at United Health Group, and at Optum. So please join me in welcoming Maya Lang to the virtual stage.
Good morning, good afternoon, everyone, and welcome. To everyone joining us virtually today, advocates, clinicians, researchers, policymakers, community leaders, and families, thank you for being here. Your presence is not passive, it is participatory, it is powerful, and it is necessary. Because today is not just about conversations, today is about action. And not just any action, informed, coordinated, and sustained action that moves us closer to a future where individuals living with sickle cell disease receive the care, the investment, and the attention they have long deserved. I want to begin by grounding us in this moment. Yesterday marked something significant. We announced the relaunch of the Congressional Sickle Cell Disease Caucus, a bipartisan commitment to recenter sickle cell disease with the national policy agenda. This is not symbolic, this is structural. Caucuses matter because they create space for education, for alignment, and for accountability with Congress. They are where awareness becomes legislative momentum. And let's be clear, Sickle cell disease does not suffer from a lack of need. It suffers from a lack of prioritization. So the relaunch of this caucus is more than a milestone. It's an opportunity that depends on what we do next. Which brings me to the theme of today's session, Voices to Action. For far too long, the sickle cell community has been asked to share its story again and again. And those stories matter. They have carried us this far. But stories alone are not enough. We are now in a moment where our voices must be translated into policy demands, and those demands must be translated into outcomes. That is the work ahead of us, and that is what today is designed to do. Over the course of this forum, we will focus on 3 clear and actionable policy priorities. These are not abstract ideas, they are targeted, strategic, and achievable. First, expanding the Sickle Cell Disease Caucus. The success of this caucus depends on participation. It depends on how many members of Congress choose to engage, to learn, and to lead. So the ask is simple but powerful. We need every one of you to engage your legislators. Ask them to join the caucus, not as a formality, but as a commitment to understanding and advancing policy solutions for sickle cell disease. Because when more offices are at the table, more issues get addressed. Second, advancing the Sickle Cell Disease Comprehensive Care Act. This is about infrastructure. It's about ensuring that individuals living with sickle cell disease have access to coordinated, high-quality, comprehensive care, regardless of where they live. Because right now, access is inconsistent, care is fragmented, and outcomes are often determined by geography rather than need. The Comprehensive Care Act is an opportunity to change that, to build a more integrated system that reflects the complexity of this disease and the realities of those living with it. And third, sustaining and strengthening federal funding for sickle cell disease. Appropriations are not just numbers on a page. They're decisions about what and who we value. Continued investment in research, data, collection, surveillance, and care delivery is essential, not optional, essential. Because progress does not happen without resources, and we cannot afford to stall. Now, I want to pause here for a moment because I want to speak not just as a policy leader, but as someone living with this reality. Sickle cell disease is not theoretical, it's not episodic, it is constant. And navigating systems that are not designed to support you while managing a lifelong condition requires resilience. That should not be necessary. Policy is often discussed in terms of systems and structures. But at its core, policy is about people. It is about whether someone can access care when they need it, whether they are believed when they are in pain, whether they can live, not just survive. So when we talk about caucuses and legislation and appropriations, we are talking about the conditions that shape real lives. And that is why your role today matters. Because this forum is not just informational, it's preparatory. Each of you represents a voice that can influence a decision maker. Each of you has the ability to carry these priorities forward into conversations with congressional offices, into your institutions, into your networks. So as you engage in today's discussion, I encourage you to think in terms of translation. How does this information become an ask? How does that ask become an action? And how does that action become sustained change? We have designed the panels that follow to go deeper into each of these priorities. You will hear from experts, from leaders, and from individuals who are working every day to move the agenda forward. Take notes, ask questions, identify your role in this work, because progress in this space has never come from a single voice. It has always come from a collective one. And I'll close with this. Momentum is not something we wait for. It is something we build. And right now, we have momentum. We have a relaunch of a caucus. We have legislation ready to be advanced. We have a clear case for continued investment. The question is not whether the opportunity exists. The question is whether we will act on it. So let's move together from voices to action. Thank you.
Thank you, Maya, for such wonderful words. We'd like to now transition to our congressional remarks from our leader of our Sickle Cell Congressional Caucus, Representative Glenn Ivey.
Because sometimes, this happened to me one time, as it turned out, I was wearing the same tie in the room that I had in the photograph. So somebody was like, damn, bro, you didn't have the tie. You just want to rotate a little bit. It's good to be here today. I think this is a great cause and one that I've been very interested in for a great deal of time. I represent part of Prince George's County. It is 2/3 African American, and I come from a background, especially when I was still in North Carolina. Rocky Mount was still segregated. We lived on the black side of the tracks, obviously, across the street from Booker T. Washington High School. And those routes, the lines of segregation have changed, but there are still lines with respect to research and medical treatment. There was a young man who lived across the street from me in Cheverly's, where I live now, who had sickle cell anemia. And he frequently would have very bad incidents of it and would go to the hospital. And many times they refused to give him pain medication. And so sometimes my wife, Jolene, would go with him because magically when she went along, it somehow got more likely that he was going to get the actual medication that he needed to get through that episode. And it also inspired her, after she became a member of the county council, to support those efforts to try and address it. So the University of Maryland Hospital in Landover was something that she helped to bring to Prince George's County, and is now helping with respect to the funding for the Sickle Cell Center in that hospital, which has gotten off to a great start. And I'm really proud of the fact that it's there, and I'm now in a position to try and help it additionally here in Congress. I've got bipartisan support, as you heard a moment ago, with respect to this. Danny Davis had been running this for a while and doing a great job with it. He's leaving Congress, and that's the photo of us, sort of a passing of the baton, so to speak. And I'm happy to try and step in, although those are very big shoes to fill that he's left behind. And then Rich McCormick, Congressman from Georgia, provides the bipartisan angle with respect to this. We look forward to working together to move these things forward as we get together with respect to this caucus. So from my perspective, there are a lot of possibilities. This is potentially a very good time for this kind of research and these sorts of efforts. We're also working, though, in the context of what's going on more broadly with respect to what the Trump administration is doing to scientific and medical research across the board. I have people in my district who have been working on projects. One that sticks in my mind is a PhD in neurophysics, I think it was, who was doing Alzheimer's research. And she was forced out and during the Doge cuts, and the clinical trials were shut down. So we know that these aren't the easiest of times to be doing this, but still the need to do it is clear, the mission is clear, and I think the path forward is clear as well. So we need to keep working to get it done. And Six Cells, I think, is doing outstanding work. I look forward to working with them and all of you to make sure we can move this forward. This is long overdue. There's a lot of other scientific and medical research projects that are behind the curve, especially when they focus on groups other than white males. We're trying to break out of that. This is one piece of it. There are other aspects of that we're working on as well, but I'll save that for the next meeting. But let's get this done. And I look forward to working with you, and I appreciate the fact that you're here today, despite the calls of tornadoes and storms and flies and locusts and everything else they got coming. It shows your commitment, your dedication to making sure we can make this work. So without that, I look forward to working with all of you. Thank you so much, and keep up the great work.
We're so incredibly grateful for the steadfast support of Representative Ivey, and we're grateful to work with him and his team for those remarks from yesterday's really great briefing that we held. So We're going to move to our first panel now from Voices to Action, our congressional ask. This panel will focus on our first ask that Maia walked through, which is to join and actively participate in the Congressional Sickle Cell Disease Caucus. I'm going to hand things over to our moderator for this panel, Ebony Slaughter Johnson, Vice President at Indigo Hill Strategies. Ebony, take it away.
Thanks, Ryan. Hi, everyone. Good morning. Welcome to our panelists. Welcome to our audience. We're thrilled to have this discussion with you this morning on this really important and timely discussion. I think you all of our panelists, I'm just going to dive right in because I know we only have 20 minutes. You all, our panelists, you are, along with our audience members, you are the voices to action. So I'm wondering if you could start off, and I'm eager to hear from all of you, your answers to this question. Why is constituent advocacy so important in helping Congress understand sickle cell disease and the policy surrounding the sickle cell disease warrior community?
If you don't mind, I'd love to start. Thank you,
Yes.
thanks for having me. My name is Sickle. I'm a 20-year-old warrior, advocate, consultant, researcher in the sickle cell disease space. I received a stem cell transplant about 12 years ago. My mom is watching this, so my mom was my donor. Shout out to her Musa. And through that, I just was engaged in nonprofit work from a very, very young age, pro bono work and advocacy work. I only recently started doing advocacy and speaking with organizations like Sickle very, very recently. However, for the past 10 years or so, I've been working with nonprofits just to increase the amount of, awareness that they have for sickle cell disease as a whole. I believe this is super important because once you have awareness, then you can transition that infrastructure to having advocacy. Because you aren't going to be able to advocate, you're also be able to make change, make legislative change if you don't have the advocacy already as a forefront. So I always started with advocacy. I always started with bringing the problem to the forefront of the picture and then moving that to making legislative and policy oriented change.
I'm happy to pick up from there. So my background is that I actually started my professional career working on the Hill. And I think a lot of Hill staff are like I was back a very long time ago, where I was new to the space. I was new to the issues that our constituents cared about, and I didn't know much. You have a lot of smart people who have to handle a lot of issues, and you have to be sort of you need to know enough about a lot of things to be dangerous, but it's very hard to gather any sort of expertise in any one area. And that was something that I personally relied on a lot of our constituents who came into the office to meet with me to identify problems that I wouldn't have known existed had it not been for them alerting me to something that was wrong. And also being able to get me up to speed on what I needed to know about it very quickly. I leaned very heavily on a lot of our constituents to do that. And I think that, I like relationships that are two-sided. I don't like it when somebody comes to me. I mean, look, with every relationship in life, from who you marry to who you're friends with, you don't want somebody to always be give me, and I'm not going to give you anything back. And so I think, for me, what was helpful as a Hill staffer, and what continues to be helpful as I learn about, so many constituencies within the rare disease community, is that the patients are the experts, the caregivers are the experts, and nobody is better suited to tell your story than you. Nobody is better able to identify your needs than you. And you almost have a responsibility to let people know what your daily life is like, what your needs are, and how they can help, because they can't help something that they might not realize is broken.
I guess I'll go ahead and close it off. My name is Fabian Antoine Nasser. I am the Director of Policy and Government Affairs at Sickle, freshly on staff, and excited to also weigh in on this issue. I've been a registered lobbyist in different capacities for a couple of organizations throughout the years, and I also had a very short stint on the Hill. So I'm familiar of both sides, what it takes, what those legislators and staff are listening to, but also as a lobbyist, why it is so compelling to also not only have me in the room, but also somebody with that lived experience to offer their expertise and their experience as well. It's so critical and vital. So constituent advocacy is critical because policymakers respond to the people they represent. Data and policy analysis are important, but it is truly lived experience of the constituents that truly help members of Congress understand the urgency and the real world impact specifically of sickle cell disease. Constituent advocacy also builds accountability. It reminds Congress that policies they pass and the budgets they approve do have real life consequences for people in their districts, which is the key. When members hear directly from their constituents about the needs for better care, stronger research, investment, and more equitable health policies, it helps to make sure that sickle cell disease remains part of the national policy conversation. Turning voices into action means making sure that the communities that are most impacted by policies are at the center of shaping them.
Absolutely. Thank you all so much for those remarks. And I actually want to pull at a thread that Fabian mentioned, which is how do you what are staffers, what are members of Congress listening for in meetings with constituents and advocates? And what's the marker of a successful Hill meeting? And I'm eager to draw on your experience, Fabian, and yours, Jennifer, working on the Hill.
Fabian, do you want to take it first and then I can be the caboose?
I didn't know if we were going to piggyback, but happy to go back into it. For me, when I was on the other side of the table, listening in, my ears would always perk up when I would hear those clear, concise stories where it started to click for me. But then coupling it with the data, with the science, that always was key for me. Like I could look at a explainer in a paper and that could be great, but hearing it come from somebody who said, hey, I've had this experience within your district. I'm one of your constituents, which is so critical and important because legislators and staff want to be able to hear from the people who actually live within their districts and say, these are my experiences. This is why these programs need to continue getting funding. This is why we need to, whatever our ask involved, this is why we need to continue listening to these stories. That's what will always have my ears perk up. I know everybody had different experiences, but I think being able to tie your stories to the data, to the science, and creating that common thread it would always be key for me.
Absolutely. One thing that I would mention, I know this is the federal ask portion of the event, but I want to draw the distinction between, that there's a federal side to what you need and there may be a state component to what you need. And unfortunately, I would have a lot of people take the time to come in and meet with me. I worked in the district and in DC, which I'll get into in a minute, but people would come in and do a meeting and then I would realize halfway through that I couldn't actually help them because what they were coming to me to talk about was state related issues. So I guess first and foremost, make sure that your audience is the right audience. And after you do that, I think it's great to go in and share your experience, but you need to really have a defined ask or a clear problem that you are identifying. Is it access? Is it a coverage issue? Is it a research funding issue? Whatever that is, be sure that you are clearly stating what it is and Usually it's best if you have a very specific ask. Now, you could go in and do the kind of meeting where you just say, I just want to get to know you and introduce you to like this issue, and then have it be more of a informative type of meeting where there isn't a specific ask, which, we can talk about those kinds of meetings later. But generally speaking, if there's something that you need, you have to be very direct in saying what that is, because it just makes it easier on the staff person if you say, I need help with this Medicaid issue, for example, or whatever it is, and they can know exactly what you need rather than trying to figure it out themselves.
No, that's fabulous advice. And Jennifer, I'm going to stick with you for one more question, because you mentioned the importance of relationship building, which, as someone who's been lobbying for several years now, is one of my favorite aspects of the job, but can also be one of the most challenging sometimes. So I'm wondering, can you speak to how our advocates can relationship build with federal stakeholders themselves, and how they can work through their federal representatives, if they have them, to do that relationship building as well?
Absolutely. I love the relationship building. I have to say, it's really great to meet a lot of like fresh new faces on the Hill, because there's a lot of turnover with staff. There's a lot of member turnover, particularly lately. And so the relationship building is something that you may build and build and build, and then the office that you've been working with is no longer there, and then you have to kind of start over again. So just be aware that, there is a lot of change, particularly in the House every couple of years, and that, you're going to constantly need to be working at it. That said, I think there's a lot of belief that you have to come to DC to do this kind of relationship building, and you don't. It's great if you can be here, but I got to say, DC is often, busy. If it's a session day, you might only have a couple of minutes in a hallway with a staff. You may never get to meet the member. I always encourage people, if you're really interested in kind of developing this longer term relationship with the office, use the district offices of these members. I worked in the district, and I will tell you, after having worked in both here in DC and the district is a way better place to do the meetings, because you can hit the members when they're home from a district work period. Everything is more relaxed. They're out and about in the community anyway. They have more time to give you. You're not being interrupted by hearings and votes and events. And it is a really great place if you just want to sit down and have 15 or 20 minutes with your representative. You should try to do that in the district. As far as the staff goes, like I said earlier, being that resource for them is going to really help a lot and go a long way with that relationship building. Doing some of the work that the staff just don't have time to do is something that's going to be really helpful. And the more you interact with them, the more trust hopefully will be built. And then when you just have a problem and need something immediately, you'll be able to go to that office and say, we have like a massive cleanup on aisle 9 that needs to happen. Can you help? And they already have that familiarity with you, with your issue, be more apt and better suited to jump in and help in a little bit of a crisis, which unfortunately we see more these days than in past years. But start with the district if you can. I think it's probably easier for everybody. It's the most underused resource. So I'm here to plug it, because it will be a really great option for you that you probably didn't see coming.
Yeah, thank you. Oh, I'm sorry, honey, please, if you want to.
I was gonna say, this is great homework for me and the rest of the advocates on this call.
Yes.
I'm a really, really big advocate in the sickle cell disease space. Like, obviously I'm a warrior. So with that, like, just being able to see how much time that these legislators and these stakeholders have devoted to joining things like this and doing grassroots initiatives like this is really, really just means a lot to me and to the rest of my team. For instance, I just started a company called True Believer Strategy, and it's a nonprofit health equity consulting firm. And so with that, we are able to connect stakeholders like the policymakers, like on this call, with the patient insights, the people who are making the patient insights, and the warriors themselves. So this is really huge for the advocacy team and for my advocacy team, because I've been involved in advocacy for probably I don't even know how many years at this point, but just know it's a lot. It's know it's a lot of years. But yeah, that just means so much to me hearing that, and I'll definitely be able to jot those notes down as a homework assignment for sure.
Yes. Well, hold on. Stay unmuted for us because my next question is going to be
Okay.
first. But Jennifer, that was great advice. And yes, I'm following Hanif's lead. I'm mentally logging that advice as well for practice at Indigo Hill Strategy. So thanks again.
You're welcome.
But first question to you, Hanif. Can you tell us what are some effective tools that we can use to educate members of Congress and staff members about sickle cell disease and the policy implications? And we've already started to talk about that for sure, but just more to the point. And are there distinctions between the most effective tools when you're speaking from a lived experience versus a professional experience?
So I think with tools, you have to think like warm skills, right? You have to think like authenticity. I'm very authentic in my regard when I talk about my story. So for example, I had ACS, acute chest syndrome, at 8 years old, and I had a 20% chance of surviving. And it's saying like key points like that, like things that are super, super like tugging at the heartstrings. It's super important for legislators to hear that because they know like, okay, like this is like a real human being that's attached to this bill. We have all these bills, we have all these things that can attach, we have all these data. We have all the data and the numbers in the world. Like there's 6 million people around the world and with sickle cell disease, and there's over 150,000 people in the United States alone with sickle cell disease. So those aren't just statistics. Those are people. Those are human beings. So I think being authentic and being really right in how we approach ourselves, how we tailor our stories. For example, like myself, I've been able to draw like maybe like a narrative of my story about going from having, ACS to having been in a medically induced coma to them having a stem cell transplant at 9 years old, and then using that as a way to empower my motivation to turn that pain into passion and that anger into aggression. So calm aggression. But you get what I'm trying to say. Yeah. Is that good?
Oh, that's perfect. Thank you. Jennifer, Fabian, anything else you'd like to add to that?
Yeah, I was just going to add like that tailoring, that messaging is so important. Like, for example, if you know that a legislator is a physician, he may really resonate with the data and the science aspect of learning about sickle cell. So lean into that. If you know that a legislator is a parent or father, like you could, or a mother, or you can lean into that when you are speaking with the legislator. So kind of doing that little background, like, or even that lived experience. You live in their districts. You may attend their same church. You may know somebody that attends their church. So you could get a little bit of intel on what may resonate with them more or what they really do tend to lean on within their communities. Those little tidbits always do help to make those meetings a little bit more impactful, I will say.
The only thing that I would add, and everybody had excellent points, is that there is something to be said about coalitions. And I think that we really can't underestimate the importance of trying to take everybody under the umbrella and try to do some meetings where you have, like a patient and a researcher or, a patient and a physician, or if there's some way to do some coalition building as you're conducting some of these meetings and the relationship development. I just think, it sends a message when you are, everybody's sort of aligned on the same page that it's under this big umbrella, and it's a really powerful message. So, that may be something that is more of like a DC type activity, but if there's any way to engage others as you're, working through these meetings, it's always a good idea, and it's a great look.
Great. Thank you, everyone. Any other tools we'd like to add before I ask my, possibly looking at the clock here, possibly my final question? Okay, well, that was phenomenal advice. Thanks so much again, everyone. I'm wondering, sticking with the theme of advice in preparation for the day of meetings tomorrow, on a human level, number one, this is a weighty issue. It's an emotionally fraught issue. It's a complicated issue. And it's also sometimes very difficult for people to engage in public speaking. Just to calm the nerves for people who maybe don't have a ton of experience doing this or haven't done it ever before, just find the idea of speaking publicly, like myself, to be unnerving. Any general advice you can share on that front to kind of calm the nerves?
I'd love to take this question just because I've been public speaking for.
Yeah, please.
I did my first speech. My mom is in the call, so she'll tell you. It's also my late father's birthday. He had passed away 6 years ago in April. But I remember specifically. If you search me up on Google, there's an image online of me in this of me at 10 years old in this big suit. Right, that I give a speech at my elementary school, Limekiln Elementary School in New York. And I say the piece of advice that my parents gave me during that time for that event was everyone is a human being. Everyone's a human being. Everyone just treat people how you want to be treated. People will treat you how they want to treat you, right? I think with me, I've been public speaking for such a very, very, very long time since that image in your head that you have being a really young kid. I gave my first speech at 10 years old. And I've been just doing this for a very long time. So with that, I've just always been treating it like everyone like they're a human being because they are a human being. And so in my opinion, depending on how your religious preferences, but for me, the only person perfect that's perfect is God. So for everyone else, it's I got to make sure that I try not to, put anyone else on a pedestal that shouldn't be on a pedestal that they don't want to be at. So for me, I really think I look at okay, although I may get nervous, nerves are natural. I'm a neurobiome major at Harvard. Right, so I understand that nerves are because of the dysregulation of your nervous system, and I don't want to bore you with all the nerdy stuff, but you know what I'm trying to say. So nerves are natural, nerves are regular, nerves mean you're a human being, but that means that everyone else is a human being at the same time too. So just having that be at your forefront of your noggin when you're giving those speeches is really crucial to just doing public speaking, in my opinion.
100%. And I'll remind everyone that often the staffers themselves are new to their position, new to the issue, so they may be feeling a little nervous as well. So the point about everybody being human, so well taken.
I will say the best piece of advice that I ever got was from my grandfather. And it was right before I started my job on the Hill. And he said, just remember that everybody puts their pants on the same way. So just, it sounded so folksy at the time. And I didn't think when I was 50, I would be recalling this thing that he said to me when I was 23, but it's very true. The other thing I want to say is that when I worked on the Hill, I used to have constituents call me and yell about stuff and tell me they pay my salary, so I have to listen to them. And they were not wrong about that. They did pay my salary. They didn't pay me a lot. They did pay my salary. Don't say that. But I guess the point is you have the power. They work for you. These offices work for you. You have the power. Go in and tell them what you're experiencing and what you need. You have every right to do it. And this is what you should be doing. And, policy takes time. Just start. And the meeting, I promise you, every meeting that you have will be better than you think it would go.
Excellent. Well, I think that may be all the time that we have for our session. Thanks so much to the panelists for that phenomenal advice that is very transferable throughout life. Great professional and life advice as well. And thanks to the audience for being here. And good luck to everyone tomorrow. Back to you, Ryan. Thanks.
Thank you.
Thank you guys so much. Thank you to Jennifer, to Hanif, to Fabian, and to Ebony for truly such an informative panel. I will tell you guys, I'm so happy that I was on mute and my video was off because I was over here plus one to everything that they said. So truly a rock star panel and a really, really great moderation. So why don't we transition over to our second panel, which is going to support our ask number 2 to support it's going to support our second ask on comprehensive care legislation. I'm going to pass it over to Victoria Jim, who's the director at Levitt Partners. Victoria, the floor is yours for you and your panelists.
Great. Thanks so much, Ryan, for that introduction. And many, many thanks to Sickle for inviting me to join today's programming. It's really always an honor to speak with advocates. I'm really excited to hear how all of your conversations go. As Ryan mentioned, my name is Tori Jem, and I'm a director at Levitt Partners and an advisor to the Sickle Cell Disease Partnership. So during this panel, you'll be hearing from experts about the importance of the Sickle Cell Disease Comprehensive Care Act. So as you may already know, as you may have already heard today, the Sickle Cell Disease Comprehensive Care Act allows states to establish Medicaid health homes for patients living with sickle cell disease to provide coordinated and multidisciplinary care, which is vital for the overall care of individuals living with sickle cell disease. So you'll be learning a lot more about what that means in just a minute. I'd like to welcome our wonderful panelists for this session, Stephanie Kaplan, Director of Government Relations and Public Health at the American Society of Hematology, and Edward Donald Ivey, Vice Chief Medical Officer at the Sickle Cell Disease Association of America. So I know that the time we have is brief, so let's jump right in. Stephanie, I'd like to start with you for the first question we have here. So given your work with the American Society of Hematology and your involvement in shaping this legislation, can you briefly explain the purpose of the Sickle Cell Disease Comprehensive Care Act and how it is intended to strengthen the national care infrastructure for individuals living with sickle cell disease?
Sure. Thanks, Victoria. First, I just want to thank Sickle for the opportunity to participate in this great forum. We've appreciated our longtime partnership with Sickle, and we're also very grateful that the Comprehensive Care Act, which Ash has been a champion for, is on your agenda for tomorrow's program. First, I just want to say that Ash has long been focused on sickle cell disease. We've worked on sickle cell policy for multiple decades, but over the past decade plus, Ash has had a focused sickle cell disease initiative where policy and advocacy has been central to our efforts. And as we continue to work on all aspects of sickle cell, we knew that prioritizing comprehensive care and access to comprehensive care was pivotal to really changing the challenges that many individuals with sickle cell disease face. So we spent a lot of time working with providers and the patient community to really understand what comprehensive care really looked like and how we could translate that into legislation. This legislation has taken different platforms over the past couple of years in terms of how it would be delivered, but it has focused on how can we make sure that individuals with sickle cell have access to comprehensive care, and that's the whole portfolio of every type of provider that you could imagine. And so this health home would basically, this bill would essentially create a health home that states could apply for with sickle cell disease as the central condition. And the goal is really to help alleviate the fragmented system of care that many people with sickle cell face in terms of the challenges and disparities. And it really is a way to coordinate services and to deliver comprehensive care in a structured way that allows each state to work with the community to develop. It basically would provide comprehensive care management, care coordination, comprehensive transitional care from inpatient to other settings, patient and family support, and referral to community and social support services. So we truly believe that it will really help improve the care and also improve the quality of care.
Great. Thank you so much. That was incredibly informative. So Dr. Ivey, I'd like to turn to you for the next question. So Dr. Ivey, from your experience, both in federal health leadership and within the sickle cell disease community, what would passage of the Comprehensive Care Act mean for individuals and families living with sickle cell disease?
Yes, thank you so much for that question, Victoria. So just to give a little bit of background about myself. So as you mentioned, I am an individual that lives with sickle cell disease hemoglobin SS. But in addition to that, I did spend several years working with the federal government, first at the National Heart, Lung, and Blood Institute on the sickle cell guidelines of 2014, and then at the Health Resources and Services Administration on the Sickle Cell Disease Treatment Demonstration Program and the Sickle Cell Disease Newborn Screening Program. The passage of the Sickle Cell Disease Comprehensive Care Act would be very important to the sickle cell community, as you mentioned, to build that capacity to deliver medical homes or health homes to individuals with sickle cell disease. I have been very fortunate in that I have benefited from a therapy called hydroxyurea. And hydroxyurea has really helped me to combat sickle cell disease, to live a healthy life with sickle cell disease. We had a speaker just earlier that he benefited from from cell therapy, from having a transplant that he received from his mother. So we know that now we can treat sickle cell disease. There are strategies to address the complications of sickle cell disease. Unfortunately, even in the United States, not everyone has access to these therapies. Not everyone has access to the doctors that have knowledge about how to treat these therapies. Not everyone has access to the tests that they need to stay healthy, or the medications that can help them to stay healthy. And so passage of this act will allow us to build that infrastructure and strengthen that infrastructure that allows us to deliver care to individuals with sickle cell disease. In my work at the Health Resources and Services Administration, we worked on strategies to improve access to the health homes that was mentioned earlier. And those health homes is not a physical structure, it's not a building. So if you look at what the definition of a medical home is, it's really a concept of providing comprehensive and high quality care to individuals. And it includes several principles, which includes accessibility, it's family centric, it's continuous. So it follows the individuals throughout their entire lifespan. It's comprehensive. So as Stephanie Kaplan was just mentioning, we have to focus on more than just the hematologist or more than just the emergency room physicians. How do we bring all of the physicians that are needed into that comprehensive care model? It's coordinated. So it's not just where the patient comes in and receives services, but how do we make sure that we're coordinating that care also, so that we're addressing all of the needs and all of the barriers that might exist in delivering care to that individual. It's compassionate, and then it's culturally effective. So we have to look at, well, what are the strategies that allow us to build these comprehensive care models? And passage of that act will allow the Center for Medicare and Medicaid Services to more effectively create models that support the implementation of these homes.
Great. Thank you so much, Dr. Ivy. That was incredibly informative as well, and really appreciate you sharing a bit more about your background in this space. That really helps, I think, add important color there. Stephanie, would love to hear if you could share more about why congressional action through legislation like the Comprehensive Care Act is really critical at this moment to improve access, coordinated, and comprehensive care for people living with sickle cell disease.
Sure. Thanks, Victoria. And I think a lot of what I'm going to share is builds on what Dr. Ivy just mentioned. But first, I think it's important to note that there are health home options out there, but to be part of a Medicaid health home right now, you have to have 2 chronic conditions. So the legislation essentially would put sickle cell disease as the one condition that you would need for a state to apply for this. So one, it just raises awareness for the need for this and really helps enhance the interest in the state. As we know, there are a lot of questionable things happening with our healthcare system right now, including cuts to Medicaid and other resources that are being pulled. This Comprehensive Care Act would basically provide resources to states to help address some of those barriers, and would really enhance the state's interest in wanting to get the federal funding match that would allow for them to implement this important type of care. And over time, we know that comprehensive care really helps reduce the cost and also improves the quality of care. So in a time when a lot is being pulled in terms of resources from states, this is a big interest. And also at a time where a lot of coverage and access related things are being pulled, this is also a benefit to the community. In addition to that, as Dr. Ivy mentioned, he has a really strong care team and has had access to that team. And because of that, he's had the opportunity to learn about the great therapies that are out there. And I think the important thing to note is that without comprehensive care and without a strong team of doctors, unfortunately, the community won't have access to these therapies, won't be able to learn about them. So I could go on, but I think those are the main key points. So I'll pass it back to you, Victoria.
Thank you so much, Stephanie. I certainly think coverage of those key points is really helpful for the attendees. I think, Dr. Ivy, I'd like to turn to you with one more question before I have one final closing question for you both. If members of Congress take away one key message about the importance of advancing Comprehensive Care Act, what would you want them to understand about its potential to impact on care and outcomes for the sickle cell disease community?
Yes, thank you for that question, Victoria. So definitely I would want them to understand that sickle cell disease is now very much treatable. We have strategies now to really address sickle cell disease. But as it was just mentioned by Stephanie Kaplan, unfortunately, not everyone has access to these therapies. Not everyone has access to the doctors that have the knowledge about these therapies. And because of that, there are a number of individuals with sickle cell disease that are not receiving the care they need to live a productive life. So we have the strategies, we have some of the resources in terms of our knowledge about treating sickle cell disease. We must now ensure that that knowledge is disseminated and is able to reach the individuals that really need it. And so really driving home to the legislators that their constituents are depending on bills and legislations like the Sickle Cell Disease Comprehensive Care Act to really build that infrastructure that allows them to get access to care. Once an individual has that access to care, then they can go on to live a very productive life. I was fortunate enough to find hydroxyurea earlier enough in my life that I was then able to go on and to become a doctor and to really give back to my community members. We want to make sure that everyone with sickle cell disease has that ability. But we know that if we don't invest in our system, if we don't allow individuals to really get exposure and access to those doctors with that knowledge, then they may never have access to those therapies. It was mentioned earlier by one of the presenters that he had acute chest syndrome when he was younger. And unfortunately, I had acute chest syndrome while I was in college. And that episode of acute chest syndrome could have ended my life. And then one of the reasons I started hydroxyurea is because the doctor at the time informed me that, well, once you have one episode of acute chest syndrome, your risk increases. And with every subsequent episode of acute chest syndrome, you have really severe damage that can happen. Well, we want to make sure that we're catching individuals with sickle cell disease early, getting them into those therapies that can prevent the occurrence of end organ damage, and then also allow them to live a more productive life. Passage of this bill allows that infrastructure to be created so that we can ensure that every individual with sickle cell disease has access to a health home, which gives them access to doctors that are knowledgeable about the therapies for treating sickle cell disease.
Great. Thank you so much, Dr. Ivy. You both are such wealths of knowledge, and I really wish we could talk to you for so much longer, but I know we've only got just a few minutes left. So I just want to ask a final question for both of you. Are there any final thoughts you'd really like to leave attendees with today? Any final thoughts on Comprehensive Care Act, or just how to message about the importance of progress for patients living with sickle cell disease? Stephanie, I'll start with you first and then move over to Dr. Ivy.
Sure. I agree with a lot of the comments that were shared earlier. I think really telling your story and your perspective, and I think as you're focusing on this particular ask, sharing your experience either with receiving comprehensive care and how it's really helped enhance your life and health care outcomes, or what happens when you don't have comprehensive care, whether it's you, a colleague, a friend. I think another point is that I always like to share how comprehensive care is the key to unlocking improved outcomes, better access. There can be all the research in the world, there can be lots of progress, but if people don't have access to this care, then unfortunately the whole community and the whole infrastructure of all things related to sickle cell can't be successful.
Great. Thank you so much. Dr. Ivy, go ahead.
Yes, and I think there will be several things I would want to lead the group with, but I want to start with the federal ask that's been distributed, which is on the screen now. And as you talk to the legislators tomorrow, you want to kind of keep it short, but very specific, and let them know what needs to take place, what needs to happen. So I think having this list of join and actively participate in the Congressional Sickle Cell Disease Caucus, support and advance Sickle Cell Disease Comprehensive Care Acts, and then continued funding for sickle cell disease program. That's a message that's very important to deliver to the legislator. You can have very limited time. And so there are other experts that can help to deliver the message, but in the limited time that you would have, really send home that message that we need their engagement. We need their engagement at the federal level to make sure that individuals with sickle cell disease continue to have the access to the therapies. As we move forward, and of course, once the act is passed, implementation becomes very important, and we have to look to who are those other stakeholders that can allow us to implement it. We have to look more at the state level. But right now, we want to really focus on the passage of the act. And so we want to make sure that we're delivering those succinct, concrete messages to the legislators so that they know the actions that we want them to take.
Great. Thanks so much. I think that's great points to leave folks with in terms of sharing your story and being succinct in the asks, giving members of Congress that direction of how they can help is really, really wonderful reminder. So really just want to thank you both for your time and for sharing your expertise. And with that, I will turn it back over to Ryan.
Thank you.
Thank you.
Thank you so much to Stephanie, to Dr. Ivy, and Tori for that incredibly powerful conversation on such critical legislation for our community. For the third panel, I'll be putting on a very different hat, and I'll be joining as your moderator for this panel. This panel is funding the work, turning policy into care. And this is what's going to address ask number 3, which is the continued funding for sickle cell disease programs. In this panel, we'll be discussing the critical role of the National Institutes of Health, the Center for Disease Control, the Health Resources and Services Administration, and the Center for Medicare and Medicaid Services in sustaining the programs that our community depend on. So joining me are 3 extraordinary experts, and I'm so excited for you guys to get to know a little bit better. First, we have Angie Snyder of the Georgia Health Policy Center, Marilyn Jotellin of the Duke Comprehensive Sickle Cell Center, and Fatmata Williams of the Connecticut Social Services. Panelists, let me know when you guys are here. Awesome. I think we may be ready to start. Hi, guys. So good to have you here today. Thank you guys so much for joining. I'm so excited for this conversation, and I know we only have about 20 minutes. So I'm going to jump into the first question. And Angie, I'm going to start with you. And again, this is for all of our panelists to answer these questions. Angie, from your perspective, why are some of these federally funded programs that we've talked about throughout this morning so critical to advancing care for individuals living with sickle cell disease?
Well, I'm here representing the Sickle Cell Data Collection Program, and one of the reasons why it's really important is because it collects data not just from folks that live near comprehensive treatment centers, but people all over the country. And it's a state program, so I can speak for Georgia. I'm the Georgia PI for that project, but it's helped us identify where all the folks living with sickle cell are in the state, and it's helped us target our activities, making sure that folks living with sickle cell in more rural areas have access to good care, and also making sure that they know about all the other programs that the federal government and the state government have that can complement their care and help them, live better lives.
Thank you, Angie. Fatmata or Marilyn?
Yes,
I'm sorry.
thank you. Can you hear me?
Yes, we can hear you.
All right. So thank you so much, Ryan, for that question. And to add to what Angie said, for me, coming from a Medicaid perspective, since my agency is the agency that administers the Medicaid program for members in Connecticut. For all of these agencies to receive funding is really important, because when you look at the National Institute for Health, the work they do around research is what is making these novel treatments available to our members. Dr. Ivy mentioned hydroxyurea. It was only that medication and maybe 3 others that were available to treat people. And most times people have bad reactions to some of those medications. But now we see other medications coming into the space, albeit very, very cost prohibitive. When you talk about the Centers for Disease Control and Prevention, Angie mentioned the data, the surveillance. I'm looking at who has sickle cell, where are they situated? Are they mostly in the rural areas, and how do we get them? HRSA, talking about the workforce, trying to educate and bring up providers that can really provide high quality care, including coordinated care. And my agency really works closely with CMS, the Centers for Medicare and Medicaid Services, where we receive funding to not only run our Medicaid programs, but also, if you look at the latest cell and gene therapy access model, a way to expand coverage and access, including looking at health equity when you consider who's impacted by sickle cell disease, whether it's in this country or whether it's globally. So yes, we do need funding for all of these different agencies, even though they're impacting different aspects of the healthcare system.
Absolutely. And thank you so much for showing how interconnected some of these agencies and programs are. I think that's a really vital point to discuss with our advocates today. Marilyn?
Yeah, so I listened to some of the last session with a lot of emphasis on comprehensive care. But as we've heard from 2 people already, it's hard to make comprehensive care happen if all the pieces aren't in place. And so the federal funding really can hit, and often does hit, every single one of them, although not perhaps as consistently as we would like. And that is partly or to a great extent limited by funds available. But comprehensive care starts with newborn screening. It starts with screening such as for strokes in little kids. It requires that providers are trained. In my state of North Carolina, only about half the patients that we can track through Medicaid as existing in North Carolina actually come to comprehensive sickle cell centers, of which we have 5. In our own center, half of our patients live more than 50 miles away, and we encourage them to have primary care physicians closer to home for that reason. But this only works if the primary care physicians and the emergency room physicians understand what needs to be done, what they should treat, perhaps what they should refer, things like that. And so that training the provider workforce is critical, starting with the primary care physicians, but also and the emergency room physicians, but also to the specialists, because we train hematologists for adults and for children with grants that go to places that do that training. And if we don't have funds to train those physicians, we're not going to have those physicians. So it's really important. The training really is throughout the spectrum of care. And then I think the CDC was mentioned, and data collection. I think understanding population level data is really important, because it allows policymakers to actually make rational policies, both at the state level, at the federal level, and even to some extent at the level of individual health systems. And so, I think we've heard Medicaid, that's variable. It works differently in each state. It's actually meant, I think, to work differently in each state. But all in all, we need those states to have the data. and the understanding at the legislative level and at the agency level, what's required for their population in that state to gain access to care and to receive good care and the comprehensive care, because sickle cell disease is a very complicated disease.
Yes.
And it affects almost every organ in the body. And we need pulmonologists and cardiologists and nephrologists, among others, and orthopedic surgeons to deal with the most common, and neurologists, I forgot, to deal with the most common complications of sickle cell disease. And if we haven't educated them and provided them with evidence-based data to say what they need to know and what they need to do, then we're not doing a good job. And this requires money, and it requires advocacy isn't a word we usually use when we're talking about the government, but in a sense, we do need the government to not only provide funds, but to provide guidance or advocacy, if you will, to get people up to speed and to get healthcare up to speed. In that setting, I think when any of these, and also I think Fatma mentioned research, and I've been doing research, basic research on sickle cell disease for decades. We still don't entirely understand how sickle cell disease causes the problems it causes. We're getting new drugs because we're expanding that knowledge. And if we don't keep expanding that knowledge, then the pathway for new drugs will dry up because we just need more understanding about the disease itself. And I'll just say one comment about the expensive treatment. I mean, even the kind of daily pills and monthly infusions that we might give patients, they're expensive, and they're beyond the capability of not only patients who don't have health insurance, but they're even hard to argue for in a lot of settings where either a federal or state provide healthcare sort of insurance provider like Medicaid or Medicare, or the more kind of employer organized health programs. Those become prolonged arguments when you're speaking from my point of view, which as a doctor, that's time wasted once we have drugs and treatments that are FDA approved and proven as effective. And yes, there's some judgment for individual patient which treatment route they should go on, but doctors should not be spending hours trying to argue that their patient fits into that slot instead of taking care of patients and spending more time with patients. So I think that there's a lot of fronts to address here when it comes to funding, because our health system, works on funding, but
yes.
But it really is all interconnected. And if one part fails, then another part's going to fail.
Yeah, absolutely. I just want to say, I absolutely love your remarks and the work that you're doing. So thank you so much. You've provided me with one of my favorite quotes thus far, which I'm going to read it from my notepad because I wrote it down, which is, it's hard to make comprehensive care happen when all the pieces aren't in place. And I recognize that they touched on that a little bit at the panel previous to this one, but just really want to underscore that, so many of these programs and the funding that we're talking about for these programs are so interconnected. And so when you talk about comprehensive care, provider training, data collection, Medicaid, right? Like all of these things have to work really lockstep with one another in order for us to see improvements from the individual or community perspective. Thank you so much for the work that you guys are doing. The next question, Angie, I'll start this one with you. You, from your perspective in Georgia doing the work that you're doing, would love to know a little bit more about how the work that you're doing all that federal funding that is used to fund that work, especially with the CDC, as you mentioned, turns into tangible improvement for patients?
Right. I can give you a few examples. I can give you an example from Georgia. I can give you an example from some of the other participating states. So one of the ways that we used our data was we share our data with all of our state stakeholders. The Georgia Sickle Cell Association, of the Sickle Cell Association of Georgia, they have our data, and they identified areas of the state where there are people living with sickle cell disease, where they might be, as Fatima mentioned, far away from a comprehensive sickle cell center, and there is a need to train the workforce in that area that are actually serving those patients. So maybe it's a primary care provider, and so they have instituted training programs for primary care providers in those areas, as well as deployed several community health workers that are specifically trained to support the warriors. So they've used the data to kind of identify areas of the state where there should be additional support and additional workforce training. Another example from California, and actually there is an example in Georgia too, is when you identify where warriors are and then you identify where the providers are, sometimes those don't match. And I know California used the data to get it was help to get and to make a policy recommendation to the state to get a clinic in LA County, because they did not have one. I think they probably had one in the past, but it had closed, and so they got a new sickle cell clinic in LA County. And I know we've done the same thing in Columbus, Georgia, where there wasn't really a sickle cell provider, and now there are other, like Children's Healthcare has moved in to do a satellite clinic there. So those are two examples. There's several others, but I'll let the other panelists talk about their programs that they're here to support.
Thank you so much. Mata Marilyn, any examples of the federal funding translating into tangible improvements for patients?
Well, in the days, which are now kind of long gone, where the NIH had a somewhat limited program to fund comprehensive sickle cell centers, and they were limited to 10. So that doesn't spread, hugely across the country. But when we had one, it united 3 healthcare systems, Duke, UNC, and East Carolina, that all had sickle cell centers. But it also provided money to give outreach to programs that didn't have sickle cell centers, both east and west of those centers. Our state is largely east and west, so and it provided program for lay education, and we had outreach education to lay organizations, especially through churches, but not limited to churches. Also, education of teachers, which is really important for the children when they're in school and they're dealing with sickle cell related problems. We had funded social work support for our patients. We had funded community engagement and community organizations funded by that program. So all those avenues that were kind of in support of providing the care, and from the point of view at the time, providing the care was also critical to conducting clinical research. So if you don't have the patients and you don't have the staff, and you're just trying to get patients in and out of clinic as fast as you can and deal with whatever's urgent, you don't have time to think about how to test hypotheses and treatments that would make patients better. So over the years, we have learned how better to use hydroxyurea, how better to use transfusion for very specific indications. what we should be doing with transcranial Dopplers. This all came from NIH research, and it all came in the context of funding of comprehensive sickle cell centers, which essentially no longer exist, except to the extent that some of those activities might be funded by piecemeal, what I would consider piecemeal mechanisms, like HRSA or something, with a demonstration project. But these are kind of one at a time kinds of things. So I think that that we require, our patients require comprehensive care, but as providers and as people who try to support our patients, we need also a comprehensive view of what's needed.
Absolutely. Ramada, anything you'd like to add to?
Absolutely.
Thank you.
Absolutely. Thanks, Ryan. And I think I'll just add to what Dr. Tell and Angie just said. I am coming purely from a Medicaid program perspective. Just in general, Medicaid is a partnership between the federal government and the state. So, and it differs from state to state. Connecticut Medicaid is unique in the sense that we do not have a managed care model. We have a managed fee-for-service where we get all of our claims, we administer our program, so we have ready access to our data. I can tell you we have a little over 1,000 members with sickle cell disease. So what we did, even before going for other federal grants, is what we have a program which is a sickle cell disease care condition management program. And what we do there is monitor utilization, see where our members are going, educating them, improving awareness, working with providers, connecting them to centers of excellence, and working with those providers to ensure that our members do have comprehensive care and leveraging prevention efforts, getting them into infusion even before, trying to prevent those crises that would lead them to utilizing services where we don't want them to utilize in services because we know it is not good for health outcomes for them. Then we recently applied for the Federal Cell and Gene Therapy Access Model, which is supposed to test whether CMS-led outcomes-based agreements can expand Medicaid access to new gene therapies. We got $9.95 million over a 10-year period. And so that's going to help us, even though we were offering these medications already, Casgevy and Lifigenia, those medications, the first one cost $2.2 million a dose. And the other one is $3.1 million a dose. And I'm giving the price tag because for programs like Medicaid, that's actually going to be experiencing budget cuts. Without this federal funding, it is challenging to ensure that members who meet the clinical criteria for these medications have access to them. And like I mentioned before, we have about 1,000 members. All of them may not qualify for this, but for those who do, we would want them to have access to this medication, which is why the funding is extremely important. And that's why even though we already had programs in place for our members, we keep pursuing federal funding to make sure that our members continue to get access to care. And one other thing is with all the HR1 provisions that's coming down, we are hoping that sickle cell disease does meet the federal requirement for a medical frailty, so that way people can continue to get access to care and not be dropped off their programs, right? And don't lose eligibility. So we focus on expanding that coverage and making sure that our members continue to keep their insurance and get access to care.
Thank you so much for that. And also just wanted to thank you. Oh, I'm sorry, Marilyn, do you want to?
Yeah, you heard some very big numbers. And I just want to make a couple of comments. One is that the cost for the drug is actually not the cost for delivering the drug. It's the cost for getting the drug. So the actual care of the patient, which is extensive for the better part of 9 to 12 months around receiving and providing that treatment adds a huge amount more. So even, I mean, it's enough that even a very, a person with a standard insurance that covers 80% of it, like an employer health insurance plan, if they cover 80%, that 20% copay could very well price them out of the market for that drug. On the other hand, the overall cost of caring for the approximately 100,000 people with sickle cell disease in the US is close to $2 billion a year. And so we have to understand what the context of what we're talking about is. Someone is paying that bill. A lot of different people are paying that bill. And that doesn't represent the loss of what I would call, patient productivity, them being able to enjoy a normal life, them being able to have a job and earn and support families and things like that. It doesn't include that, and still $2 billion a year. It doesn't include the fact that caregivers often have financial issues because they're trying to provide care and hold jobs. And it doesn't include actually disability payments. So I just think that if we are going to approach policymakers and legislatures and regulators in various government organizations, we have to be aware of those costs, not just what we're asking them to spend, but essentially what someone is already spending.
Right. Thank you so much for that, Marilyn. I think that's very important context here. I feel like we can talk about this really, really important topic all day. But unfortunately, we have run out of time. I'm so incredibly grateful to our panelists for giving us such a robust understanding of the current landscape, what the numbers are. 5 minutes, a great explanation of Medicaid and sort of how the funding mechanism works for Medicaid, and what's happening at the state level. So I'm sure I was taking notes. I know that our audience is taking notes as well. Thank you guys so much. We're really grateful for all the work that you're doing every single day, but really grateful for you guys taking the time to come and walk through the need for continued funding for sickle cell programs. With that said,
it's a delight to participate in this. Thank you for having
Thank you so much.
Thank you.
Yes.
Thank you, guys.
Thank you.
It's been such a powerful morning leading into the early afternoon. Before we continue with our program, we do want to take a well-deserved 10-minute wellness break. Leading us through this moment of intentional rest is a name that I know a lot of you guys will be familiar with, from especially her 10-minute moment of intentional break last year's Policy Forum is Ayola Olubukola, a member of our sickle cell community. Ayola, thank you so much for being here, and I will give the floor to you for our wellness break.
Hi, can you hear me?
Yes, we can hear you.
Okay, great. So, hello, my name is Ayola Olubukola, and it's wonderful to be here for another year. I hope everyone is doing well and holding tight with the seasonal changes. As we know, sickle cell allows a lot of different transitions in our lives, especially when it comes to stressors, and being able to be grounded and taking a moment to take a breath and remembering to just be embodied with ourselves really helps us navigate this space, but also reminds us to take time and to rest and to also just remember how important our vessels are. So if everyone could close their eyes for a moment, and the music will start shortly. I'm not sure. Okay. So as we're having our eyes shut, I just want us to get to a space where we're just sitting and being one with ourselves for the moment. In this time, I want us to take a deep breath in. I will count in, and if anyone knows how to take a deep breath, so basically as you take a deep breath in, your stomach is expanding like a balloon, and I will hold for a few moments and then we will release. Okay, so inhaling 1, 2, 3, 4, hold. Exhaling 1, 2, 3, 4, hold. Let's do that again. Inhaling 1, 2, 3, 4, hold. Exhaling 1, 2, 3, 4, release. So as your eyes are still closed, just take a moment to scan your body and continue to breathe. Let's start from the top of our heads, our face, our ears, our neck, our shoulders, our chest, our back, our stomachs, our arms, our hands, our torsos. Now that we've gone through the upper part of the body, what are some areas that are either bringing some strength, need more strength, or need more grounding? Remember to breathe and send your healing breath to that area. As we're still breathing, slowly and intentionally, let's go to the other part of our bodies. And I will count, inhaling 1, 2, 3, 4, hold. Exhaling 1, 2, 3, 4, release. As we're still holding our breaths and the steadiness of our breaths, we're going down our thighs, our legs, to our ankles, top of our feet, the sole of our feet, our toes, not forgetting the hips, not forgetting the waist. How is this area in your body feeling? What reminders do you give yourself in this moment of reprieve? What softness do you have to add to your routine? What feels comfortable? What feels tense? Relax. Remember to release your jaw. Remember to keep breathing. Take a moment with yourself to be grateful for this time, that we can continue to advocate and can continue as a sickle cell community to share our stories with one another. Be grateful to this body that wakes you up every day, that reminds you that pain is not the only thing you can or need to experience. As we continue to breathe, as we continue to be grounded, I want us to take one more intentional, slow, deep breath. 1, 2, 3, 4, hold. One, 2, 3, 4, release. I hope this time has been worthwhile, and I hope that you continue to utilize things like this, even outside of this policy hill, to just remind yourself that you deserve to breathe and to give your vessel a space to relax and to give your mind the time to actually just be grounded. And I hope that you continue to enjoy this event and that heaviness is not laying with you. If your eyes are not open at this time, open them slowly. Again, my name is Ayola Olubukola Ogunyimika, and I am the owner of Healing Through Artistic Mediums LLC, as well as a member of the sickle cell community and a warrior advocate. Thank you for this time, and I hope everyone has a very beautiful day.
Thank you so much, Ayola. I am feeling calm and grounded, and I'm sure that every single person in our audience joining us today feels the same. I think it's very important practice for us, especially as we are in preparation to advocate for really heavy things that can really, change our community. So thank you so much for your continued support of Sick Cells and for you returning back to us to give us this 10 minutes of grounding and mindfulness in such an important time. Next up, we'll take a few minutes to walk through the Advocacy Associates meeting platform in which our advocates will be using for Hill Day tomorrow. This is going to be a really important walkthrough, so please watch closely so you feel confident navigating your meetings. Of course, the Sick Cells team and my team and I will be on hand for any questions that you may have. I know we have a slide showing right now on questions for Hill Day with different contact information so that you guys can be prepared for tomorrow. And I believe that we have a recording or video from the Advocacy Associates team ready to go to walk through the platform.
Hello, and welcome to the Advocacy Associates online schedules and logistics overview. This short video will show you how to access our online dashboard for your virtual Hill Day and navigate all of its features. On a to-be-determined date by your organization, you're going to receive an email from advocacyday@advocacyassociates.com. This email will contain all the instructions you'll need to log into your schedule. If you do not receive this email on that to-be-determined date, please check your spam or junk folder, as it's more than likely ended up there, and just make sure to unmark it as spam so future communication is processed quickly. Now, within the body part of that email will be all the instructions you'll need to access your schedule. Simply click the URL that you see listed there and follow the instructions on how to log in. If you have any issues with this, please contact us. There will be a support link at the bottom of this email, and our team will reach out to you shortly to get that issue resolved. Now, once you're taken to the login screen, you'll see this dashboard. Simply enter your email that you registered for this event with and tap Sign In. We will then email you a randomized 6-digit code, so check your inbox for that. Take the code, put it in the code field, click Sign In, and you'll be launched into your schedule. If you have any issues with this process, click the support button, fill out the ticket, and our team will contact you shortly to get any issues resolved. Now, once you're launched into your schedule, you'll see a main page that will look similar to this. All of your confirmed appointments to date will have a time. Anything that's still pending will show up as TBD at the bottom. Now that you've logged into your schedule, you will get automated email notifications along the way as those pending meetings become finalized and slotted into your schedule. All times are going to be displayed based on the time zone you are located in, so you will not need to do any time conversions. To get more information on the meeting, simply click on it anywhere within this box, and that will launch you into a dashboard that will look similar to this. You'll see the date, time, and who you're speaking with listed at the very top. Below that will be a meeting chat button. Simply click this if you'd like to send a group chat to every attendee in this appointment. If somebody is to message you this way, you will get a notification email from the system alerting you of that. To join the meeting, simply click the Join Virtual Meeting button. There's a Zoom link hidden behind that button, which will automatically launch you into the virtual meeting. If you need to dial in, you'll see that information listed here. And on the upper right-hand corner, you will see a Documents section. Here you'll find talking point pages, fact sheets, background material, really whatever resources your government affairs team has provided and given access to. You can click on those before, during, or after each meeting. Below that will be your talking points tab. These will be more of your shorthand bullet point talking points to reference. And again, you can reference these before, during, or after the appointment. Below that will be a bills section. If your organization is going to be speaking about any specific bills, you'll see those listed here. Along with that will be a pill on the right-hand side indicating if that member is currently a sponsor or not of that legislation. If your organization is not speaking about any specific bills, this area will be blank. If you continue to scroll down, you'll see the attendees section. This will give you a list of every attendee that's going to be in this meeting with you. And you may see some relevant additional information there, such as job title, company name, cell phone, email, and a pill indicating if they're a constituent or not. If your organization has chosen to hide some of these features, those areas will be blank. On the left-hand side are additional resources. You can send a thank you email to the office once the meeting concludes. You can do this in one of two ways. Once you click the thank you email button, you can click open an email app in the lower right-hand side. You can see that as the red button. This will open up the email based on the native email dashboard that's on your device, such as Microsoft Outlook. If you're using a web-based email, such as Gmail or Yahoo, etc., you can simply copy all this information with the copy clipboard buttons that you'll see on the right-hand side and paste it into the email client of your choice. Below that will be the meeting report form. This will pull up a list of questions you'll need to answer about how the meeting went. You'll do this for each appointment on your schedule. You will get automated reminders from the system throughout the day if you are not completing these. You can also upload a picture from your virtual appointment. Most clients and most attendees usually do this by taking a screenshot once everybody's in the Zoom room. You can certainly do this when the staff join, or especially if the member has joined at the conclusion of your appointment. It's really a great way to capture all the energy from the meeting, so feel free to have a lot of fun with this. You can also add this appointment to your personal calendar if you prefer. Please make sure to read through the fine print before doing so. If your organization has chosen to turn this feature off, this button will be hidden. Legislator Notes is basically a blank notepad. It's an extra resource for you to take down additional feedback as needed. It's not required. If you have a lot more to say and you weren't able to get all your thoughts across in the report form, you can go here and input that content, which your organization will get from us after your event. You can also mark if the member of Congress attended or if only staff attended. This is really just on the ground intelligence from you. Sometimes we set the meeting with the member, but they get pulled away to votes, so they're stuck at committee and they can't make it. So please mark one of those options. And for anyone who's a social media fan, you can submit a post on any of these three platforms. The Meetings tab in the upper left will take you back to that home page so you can navigate your way to that next meeting on your schedule. The Bills tab will take you to an area where you can view any relevant bills that your organization may be talking about. Here you'll be able to view the text of the bill, the vote history, and the full sponsor list. Again, if your organization is not speaking about any specific bills, this area is going to be blank. The Event Feedback tab is an overall survey for the event as a whole. If your organization has chosen to use this feature, please go through and answer these questions at the conclusion of your last meeting. If they've chosen not to utilize this area will be blank. Legislators tab will give you bios for everyone that you'll be meeting with. Simply click on their name and you'll see a profile like this. It'll also come with two additional tabs, the same bill tracking function we referenced earlier, just another way to view it, and then a list of all their committee assignments for more background. Go to the Support tab if you're having any issues at all. You can fill out this ticket. Our team will contact you as quickly as possible to get any issue resolved. There's also will be a phone number listed at the bottom if it's time sensitive, and you can call our team directly. Messages tab will allow you to send either individual or group messages to people throughout your event. Simply click the new chat button, and you can either select the individual or the name of the meeting if you prefer to send a group chat. Okay, last slide here. Some relevant information and reminders to keep handy. Again, check your spam or junk folder just to ensure you didn't miss that email from us. That our domain is at advocacyassociates.com in case you need to add that to your safe list. We recommend getting into the meeting about 10 minutes prior to start time. This will allow you just to touch base with other attendees in your group about assigning roles, going over any last minute details, and getting any technical issues out of the way before the office joins. That way, when they do join, you can start the meeting right on time. All times are going to be shown based on the time zone you're located in when viewing your schedule, so you will not need to do any time conversions. If the office doesn't join within 10 minutes past the start time, please contact us through the support tab. Do give them a little bit of buffer to join, but if by the 10-minute mark no one has joined, please let us know as quickly as possible. That help number in the support tab will be your best resource for any time-sensitive concerns, so please call that without hesitation for anything that may pop up. These meetings are going to last anywhere from 15 to 30 minutes. The majority of them have been arranged for 30 minutes, but it's always important to ask the office at the beginning how much time they have. That way you can prepare your pitch and talking points accordingly. Any changes to your schedule throughout the day of the event will be sent via email. So whether that's a time change, location change, cancellation, maybe a late addition the morning of, you're going to get an email notification from our system. So make sure to be checking your email regularly throughout the day. And these last three, just make sure you have a good Wi-Fi connection, as most, if not all of these meetings will have a video component to them. Mute your microphone whenever you're not speaking. And lastly, just know your audience, ensure you have an appropriate background, nothing politically charged or inappropriate. That way the meeting can take place normally. That being said, that concludes the presentation. Thank you for watching.
Okay, I'm back. This is Ryan Hill again. I know that was a very thorough and robust presentation on how to use the Advocacy Associates platform, but just wanted to affirm to you all that it is going to feel a lot more intuitive, and you always have the Sickle team to help and walk you through any issues that you may have. So I'm so grateful that we have this slide on Questions on Hill Day, so that you guys can have the information for how to reach the Sickle team should you need anything. We're just so excited that you guys have taken some time tomorrow to be able to do such important advocacy. Okay, so the next session is going to be on getting ready for tomorrow on day 2. I'm going to next slide, please. I'm going to walk through some key terms, talk through our legislative priorities once more, our one-pager, and make sure that you guys feel fully prepared for tomorrow to represent our community tomorrow virtually on Capitol Hill. A note for the AV team, I'm going to be saying next slide throughout so you can advance accordingly. Perfect, you're already there. Okay, so let's talk about some key terms that I know we've been sort of circling around throughout the panel, the 3 panels that we had today, but I just want to spend some time talking about these. So the first key term that I want to make sure we really understand is the Center for Disease Control and Prevention, or the CDC. The CDC is an agency under the Department of Health and Human Services with our federal government that is tasked with protecting the nation from health threats. For our community, the CDC runs surveillance programs that track how many people have sickle cell disease, which we heard about earlier from our state panel, where they are and how the disease is affecting them. This data is how we make the case for our funding, as was mentioned in the last panel. The next key term I want you guys to really understand is CMS, which is the Centers for Medicare and Medicaid Services. This agency, once again, also within the Department of Health and Human Services, is the agency that administers Medicare, Medicaid, and CHIP, or the Children's Health Insurance Program. Many people in our community rely on Medicaid for their care. We know that just over 60% of folks living with sickle cell disease are on Medicaid. So it's a very important program for us. CMS programs directly affect which treatments people can access and how coordinated that care is. The last agency I want to talk about here on this slide is the FDA, or the Food and Drug Administration. The FDA regulates drugs and medical devices. The FDA has approved several sickle cell disease treatments in recent years, including the gene therapies that we talked about earlier. FDA approval, their approval processes really determine what's available to patients. Next slide, please. So continuing with our key terms, some other names that you guys have heard in panels today, which is HRSA, the Health Resources and Services Administration. I'll admit I've been doing this work for nearly 15 years and I still get tripped up on exactly what HRSA stands for. HRSA is the primary federal agency focused on improving healthcare access for underserved populations. HRSA funds programs like the Comprehensive Sickle Cell Care Programs, newborn screening. When we talk about protecting sickle cell disease funding, HRSA is likely going to be central to that conversation, as you guys heard very well on the last panel. The last agency I want to talk about, once again nestled under the Department of Health and Human Services, is the National Institutes of Health, or NIH. The NIH is the nation's medical research agency. The NIH funds research, it funds clinical trials, scientific discoveries that lead to new treatments and eventually to cures. Cuts to the National Institutes of Health funding threaten the entire pipeline of innovation and research that our community depends on. Next slide, please. Okay, so moving from the federal agencies now to familiarize yourself with some of the terms that we'll be using, especially when we're discussing our congressional visit. So these terms on the slides here are really trying to get into the meat of how Congress actually works. So let's start with a legislator. A legislator is someone who makes laws. You might hear them called a member of Congress, a policymaker, or a lawmaker. In most cases, and especially for our conversations today and tomorrow, these are going to be interchangeable. Congress is composed of the Senate and the House of Representatives. Congress's primary job is to create and modify legislation. Legislation starts at a bill. If it passes both chambers and gets signed by the president, it becomes law. I may be aging myself here, but if you guys know the I'm just a bill sitting on Capitol Hill from Schoolhouse Rock, that is what sort of got me into thinking about the legislative process. But it is very relevant and very timely because it is still true today. Legislative staff, or staffers, as we are often called, are researchers and policy advisors that work behind the scenes in the congressional offices. In many of your meetings tomorrow, you may meet with a staffer rather than a member of Congress if the member is unavailable. That's completely normal, totally important. Staffers advise their bosses. Your message is going to reach the member through the staffer. I'm a former staffer. We met with we talked to a former staffer earlier on the first panel about the work that she does. A lot of folks think that if they are meeting with a congressional office and the member of Congress does not join, then therefore the issue is not important. That could not be further from the truth. As we just heard on the Advocacy Associates prep video, oftentimes they're pulled away. The members of Congress are pulled away for votes or other critical matters. The staffers are going to be your key to the kingdom in this instance. So it is always a great time to be able to talk to staffers. A constituent is someone who lives in the legislative district if they're in the House of Representatives, or in the state if they're in the Senate, and is eligible to vote there. You are a constituent, no matter where you sit in the country. You vote for someone and you're a constituent of someone. That's going to be your power in the room. And, this is one of the things where we like to say, here, your zip code really, really matters because that determines where you're a constituent. And lastly, a constituency is the full body of voters in a given area that elect that either member of the House of Representatives or that senator. Next slide, please. So let's talk about how Congress is structured really briefly, because I think it helps you understand who you're meeting with tomorrow and why these meetings matter. So the Senate has 100 members. There are 2 senators from every state, regardless of population. They serve 6-year terms and they represent the entire state. You'll address them as senator. The House of Representatives on the other side, and I say other side, I mean other side of the Capitol, because the Capitol sits in between the House side where the House buildings are and the Senate side where the Senate buildings are. The House of Representatives has 435 members in roughly. Sometimes you have vacancies for some reasons. We'll see a number of vacancies because, the Trump administration has pulled people up into the administration and therefore their seats are vacant. You have members of Congress who pass away, unfortunately, in their time. And so the goal number is 435. We're not quite there, but we're very close. The number of representatives per state is going to vary on population. So unlike the Senate side where it's standard 2 senators per state, this is going to vary according to the population. Each member of the House of Representatives represents a specific congressional district within their state. They're serving 2-year terms, so they're consistently sort of on this election cycle. You'll address them as representatives, rep, congressman, or congresswoman. Tomorrow, you'll be meeting with members or staff from your state's delegation. Again, that's which could include both chambers, the Senate chamber or the House chamber, but we'll make sure that you know who you're talking to before you start the meeting. Next slide, please. Okay, so let's talk a little bit about the advocacy life cycle, because I think it's always really important to understand sort of where you are in this life cycle and how important every single phase is. So this diagram that you have on the screen shows the full life cycle of how advocacy translates into law and eventually care and community access. Understanding where we are in this cycle, as I mentioned earlier, I think is what is going to make tomorrow feel real and urgent as you guys are entering into these meetings. So the cycle begins with advocates, as you all are, pushing for legislation, pushing for a law. Congress drafts and debates a bill in response to that pressure. What we're talking about tomorrow, as we've heard in our second panel, part of our ask is a bill that is already introduced, right? So that really hard part of getting members of Congress to introduce a bill has already been done. We're asking for more support. If the bill passes, it becomes a law. That law establishes sickle cell disease programs and the legal authority for those programs to exist. Then comes authorization, which sets the funding levels for these programs. But authorization doesn't actually release the money. Authorization tells us how much money can be spent on specific programs. What's next, and the very critical part of this process, is appropriations. Appropriations is where Congress actually allocates the dollars to spend the money. So this step is really what moves the money from a number on paper, again, that authorization piece, to translating to real programs in your community. We know that right now Congress is allocating $15 million for HRSA sickle cell disease programs through this process, but it's an ongoing process. And I just want to make sure that you guys are aware, as we're pushing for more funding, this is part of what we're pushing for, right? Is to take part in this authorization and appropriation process to make sure that that money does flow to the community, to the programs that are so critical for warriors in the community to live full, wholesome, and thriving lives. You are at, from my perspective, the very beginning part of this chain, right? Like your voice in those meetings tomorrow is going to help us, continue the momentum for this cycle to continue, but make sure that this process is moving. Next slide, please. So I want to pause here to tie into the theme that we've been talking about all day, and really direct and be really direct about something, right? Which is that most members of Congress have very, very little personal insight into what it means to live with sickle cell disease. As we talked about earlier, they may know that it exists, but they don't know what a pain crisis can feel like at 2 a.m. They don't know the cost, the fear, the exhaustion of managing sickle cell disease every single day. And that also aligns with the staffers as well that you'll likely be meeting with. Policymakers and staffers are genuinely eager to hear from you. Your stories are what makes our policy ask here in DC. They make them real, right? That data can tell you the scope of the problem, but your story is going to tell them why they need to care about the issues that we're talking about tomorrow. They're making decisions right now about healthcare access, about research funding, about data collection, about so many things that will directly affect your life, your family's life, the community's life. They need your voice to make those decisions well. And that's why we're having this Hill Day tomorrow, to make sure that we have the opportunity to share the voices and the stories with them. And that's really what, of all of this, I want you to hold on to the most, right? Is that like, these members of Congress and are elected, they may be elected officials, the staffers, may have these fancy titles and may know the ins and outs of the legislative process or how to write a bill, right? But you are the expert in sickle cell disease and what it means for you, what it means for the community. You know this disease in a way that no staffer or senator who also does not have sickle cell disease will know. You walk into these meetings knowing that you are the expert and that they're taking this meeting with you because they want to hear from you. I was a staffer. I know so many other people were. And I can tell you, if I had to choose between two meetings that were, trying to be scheduled at the same time, I would choose the one where I knew there was an advocate. I knew there was someone I can talk to about the issue personally. I say that to say that these staffers tomorrow, they're taking these meetings because this is something that they want to learn more about. They want to hear from you because, again, your voice is so important here. Next slide, please. Okay, so let's go over once again our federal ask and what our one pager is. This is a visual overview of our 3 federal asks for fiscal year 2027. I want to walk through all 3 before we go deeper on each one. You've heard this at the onset with Maia's keynote. You heard this as we were introducing each of the panels, but I just want to make sure that we are as familiar as possible with these asks as we go into tomorrow. So the first ask is to join and actively participate in the Congressional Sickle Cell Disease Caucus. The second ask is to co-sponsor the Sickle Cell Disease Comprehensive Care Act, HR 5178 in the House of Representatives, and S271 in the Senate. And our third ask is to champion continued funding for sickle cell disease programs in fiscal year 2027 across the NIH, the CDC, HRSA, and CMS. You won't have to cover all 3 in every meeting. Your team lead will help assign which ask each person owns, but everyone should be familiar with all 3. Next slide, please. Okay, so this is a lot of text on the slide, but feel free to pull out your phone and scan the QR code on the slide for a digital copy. But we wanted to show you guys our 2026 leave behind. And leave behind is in the old school days before Zoom, we would go to Capitol Hill meetings and we would be in person. And I know some of you guys, especially those who participated in Rare Disease Week when you were on the Hill, you have physical copies of your priorities. And this is what we took to the Hill a few weeks ago for Rare Disease Week. And this is what we're taking to the Hill. We're going to follow up these meetings with this page, with this one page. I want to make sure you have this. And again, please scan the QR code for a digital copy. We're going to drop, I think we're going to drop I'm sorry. You have the digital copy on your screen. This one pager is your leave behind for tomorrow. After the meetings, you want the office to have something in hand, right? And here we're doing virtual. So this is just a concrete reminder of what you asked and why it matters. I would love for you guys to familiarize yourself with this document before tomorrow. And again, you don't need to memorize every line, but you should be able to speak to all 3 of our asks in your own words. Next slide, please. Okay, so let's talk about ask 1 from the one pager. Let's look at it before I walk through in full detail on the next slide. This ask is about congressional education and engagement in the Sickle Cell Disease Caucus. We want members of Congress actively learning about and championing this community. Next slide, please, with a little bit more detail. So our first ask, as I mentioned, is for members of Congress to join and actively participate in the Congressional Sickle Cell Disease Caucus. The relaunch of this caucus is a really big deal, and we have worked so hard to make this a reality, and we're just so excited that we've gotten this bipartisan agreement to do so. It's the beginning of a multi-year engagement strategy From our perspective, here is what active caucus participation looks like. It looks like empowering advocates to encourage their members of Congress to join congressional briefing. It looks like congressional briefings and policy discussions on the Hill, both virtual and in person, on sickle cell disease. It looks like listening sessions with patients, caregivers, and community leaders to really understand what the true needs are of the community. It looks like stakeholder convenings with clinicians, with researchers and advocates to really move the ball forward on some of the innovation side of sickle cell disease treatment and access. And it looks like ongoing collaboration with federal agencies, as we mentioned, the NIH, the CDC, HRSA, CMS, and FDA. As you guys heard towards the top of our session today, remarks from Representative Glenn Ivey, who is going to be the Democrat lead on the caucus, and Representative Rich McCormick, Republican from Georgia, is going to be the Republican lead on the caucus. That is true bipartisan leadership in an age where it is rare to come by bipartisan leadership. And I want to underscore that because it just shows how important and impactful this work is, and the importance of what you're doing tomorrow. I don't want you guys to go into a Republican office and think that, oh, maybe they don't support, right, leaning on partisanship. But I'm here to tell you, we've had such great Republican and Democrat support over champions over the past few years. And this caucus really cements that and allows for more participation moving forward. And I would also add that the bipartisan nature of the caucus really proves that this is not a partisan issue at all. It's a community issue. When you make this as tomorrow, I think the message is quite simple. We need your office to show up for this community, not just in words, but in action. Joining the caucus is how you do that. Next slide, please. Okay, so our second ask from the one pager is on the Sickle Cell Disease Comprehensive Care Act. And if you recall, this is what we had panel 2 focused on this piece of legislation. Next slide, please. Okay, so our second ask is for members to co-sponsor the Sickle Cell Disease Comprehensive Care Act. That's HR 5187 in the House and S721 in the Senate. I think you should say those bill numbers out loud in your meetings repeatedly so that the staffer can jot them down and then can follow up on their own to understand the dynamics of the bill. So here is what the legislation would do. I know we already walked through this, but again, I think it's worth another conversation here. The bill will allow Medicaid programs to establish health homes specifically for individuals with sickle cell disease. Health homes already exist in other parts of healthcare. They coordinate all of a patient's care. So think primary, specialty care, behavioral health under one integrated system. This bill goes a lot further than the current law in a few different ways. The bill allows states states will be required to include dental and vision services in that coordinated care. As we know, sickle cell disease affects every organ in your body, which includes eyes and teeth. This cannot be treated as afterthoughts. We need to make sure that they're weaved into this whole person care. The next thing that the bill would do is that it will require, CMS will be required to issue best practices for states on how to design and implement these health homes so that there's consistency and accountability across the country. As you all know, especially those of you who have engaged in seeking care in multiple states, have lived in multiple states, when you see one state, unfortunately, you see one state. And so we want to make sure that there's this consistency across the country to allow for equal access and treatment options. Under the current law, Medicaid programs may establish health homes for individuals with chronic conditions more broadly, but sickle cell disease is not specifically named or prioritized under current law, and this bill is really working to change that. So when you all are speaking to this ask, think about the gaps that you've seen in coordinated care. Think about what happens when a hematologist doesn't talk to a primary care doctor. Think about what it means. What will it mean for all of this care to be finely connected and consistently coordinated? Next slide, please. Okay, so and here is ask 3 from the one pager. which is continued funding for sickle cell disease programs. Next slide, please. I'll go into detail on all of these. Okay, so our third ask is for members to champion continued and robust federal funding for sickle cell disease programs across 4 key agencies. And I'm going to repeat them here, which you remember from our key terms, but also from our last panel when we discussed these. The first is NIH. Research, clinical trials, and innovation. NIH funding is what moves treatment from the labs into clinical trials and eventually into patient hands. Cuts to NIH directly threaten the pipeline of cures and treatments that are being developed right now. This is really critical funding. The next is CDC. As you all know, CDC is tasked with surveillance and public health infrastructure. Without the CDC data, we cannot accurately count how many people have sickle cell disease. We can't track health outcomes. We can't identify gaps in care. You cannot advocate for a community that you cannot see. And I think that our panelists on panel 3 did such a good job of articulating just that. We need to understand the full story or the data, the landscape, in order to make people's lives better. Because if we don't track that data, we can't fix what we don't see. That funding, as I mentioned, it keeps our community incredibly visible by making sure that we're tracked in the data. The next is HRSA, which is the Health Resources and Services Administration, which, as I mentioned earlier, it is responsible for comprehensive care programs and provider training. HRSA funds the sickle cell disease comprehensive care centers that patients depend on for coordinated expert care. It also funds training so that providers across the country know how to treat this disease properly. Without the training, patients face providers who don't know how to help them. And I know that so many of you all, despite the role that you play as an advocate, as a caregiver, as a warrior, as someone who is interested in policy and research, you've heard the stories of what happens when a warrior is interacting with a provider that doesn't understand sickle cell disease. You've heard these impactful stories where someone's health is on the line and they're trying to explain what the disease is and what a pain crisis is. Imagine a world in which the providers are already trained, have a more than baseline understanding, and can really act as quickly and swiftly as possible to make sure that our community is able to feel better and get in better health as soon as possible. Imagine that world. That world is in part relying on HRSA and HRSA's funding. And lastly, CMS, the Center for Medicare and Medicaid Services, which, as I mentioned earlier, is responsible for Medicaid, for Medicare, for the Children's Health Insurance Program, for innovative demonstrations and care delivery improvements. CMS funds pilot programs and demonstrations that translate research into real-world care delivery for Medicaid patients especially. These programs test what works, and if they work, they scale it. Without this funding, innovation stalls at the policy level and never quite reaches the patient. Also, as we mentioned earlier, without funding for CMS, and again, as Marilyn mentioned on that last call, on the last panel, everything is interconnected. And so this is why we wanted to make sure that our third ask is not just asking for funding for one program, it's asking for funding for all of these critical programs and agencies, because if you take one of these pieces away, then the entire system is going to suffer. And as you guys know, as people, and again, regardless of where you sit in the community, be an advocate or a researcher or a policy expert, or a company that is putting forth innovative treatments and trying to increase access, a warrior, caregiver, et cetera, you know just how critical it is for all the system to work together. That's the same exact thing that happens at the federal level with these funding. So when you're making the ask tomorrow, we ask that you make it as concrete as possible. Telling the story of what program has helped you or someone in your community, what would be lost if that funding disappeared? What would be lost if there was less funding and some of these entities had to ration and start to bring cut some programs down in order to make sure that they could at least exist a little bit? Having these real stories attached to real programs is going to be so much more powerful than just a budget line, right? Like, we know those stories are what sell. One of the things I like to say all the time is that the facts tell the stories are what's going to sell. And so it's so important that you guys feel comfortable in understanding what the ask is, why it's so important to champion funding for these programs, and then weaving in your personal story so that the staffers or the members of Congress, the policymakers, should they be able to attend, can really hear directly from you. Because again, you're the expert on all of these priorities in a way that the staffer or the member of Congress, should they not be in the community, are not experts to. Next slide, please. Okay, and I'm going to pass it off to my colleagues, Melissa and Dagmawit, to talk about preparing for the meetings.
Thank you, Ryan. And we are really excited to be joining you all today as you are getting ready for an amazing day of Hill meetings tomorrow. My name is Melissa Akinlauen. I'm the Senior Director of Community Programs, and I'm joined by Dagmawit Teka, the Community Programs Manager. Next slide, please. We're going to walk you through some of these key details that Ryan just shared as we're preparing for tomorrow and walking you through the meeting structure. So we have already met with some of these awesome team leads that have volunteered to manage and be responsible for leading the discussions with our legislators and staffers tomorrow. The team leads will be breaking out into sessions right after we conclude today to help identify really key speaking roles for day 2. So as you meet, you'll be able to start designating and thinking about who's going to share their personal story, no more than 2 people, because we want to tie those stories into those advocacy efforts and asks that Ryan just explained. So we're asking that we be flexible and give everyone a chance to speak as well. And then we'll also have 1 person per ask. So as you've learned today, we have 3 really important key asks for our legislators and staffers. So 1 person from each team will be assigned to represent that ask. And again, being flexible as you're moving around to different meetings and meeting with the legislators and staffers to give everyone an opportunity to speak. So the meetings are going to be about 15 to 30 minutes. And again, we're in a virtual setting, so less time to have to walk to offices or to get situated, but we're going to keep it concise yet personable. The key thing to remember are 4 parts of the Hill meetings: the introduction, making that personal connection through a story, making the ask, and then thanking them for their time and referring them to the resources that we're providing for you all today. As Ryan and others panelists have explained and alluded to, we may not have a legislator in every meeting. You may be meeting with a staffer. So just be prepared to maybe answer some additional questions that the staffer would like to pass along to their legislator. You'll have your team lead, your 1 to 2 storytellers, and then 1 to 3 people that have been designated to make those individual asks. For others that'll be joining the meeting, you will serve as an observer or a note taker. Help us capture some quotes, help us capture any questions that the legislator or staffer is asking. And then again, keeping in mind that everyone will have a role for those follow-up items as well. Next slide, please. So just a few reminders about etiquette for Hill meetings. We would love that you all keep your professional attire, stay muted when you are not speaking. As I've said, please allow everyone an opportunity to speak outside of just their introduction. So that means rotating the role throughout the meetings that you'll be having tomorrow. And because this is a virtual setting, we're asking that you remember to be in a quiet space, such as a home or an office. Starbucks may not be the best spot for tomorrow because it's a little bit busy and distracting. And if needed, use a virtual background. We can provide that for you if anyone needs it, or feel free to use one of the pre-assembled ones already in the Zoom feature. A reminder to say the bill number, say the ask for that caucus, everything that's provided within the resources. And just as a point of reference, the resource tab within your screen right now will also give you access to all of those documents. Identify where you're from. Remember, you are the constituent. So your city, your town, that personal connection back to that legislator, let them know that you are representing a population they are familiar with. Really key reminder, and you're going to hear us remind you of this quite often. Ask for permission before taking any pictures or screenshots after the meeting. Please, please, please do not record the meeting with the staffer or legislator. Remember to say thank you. Again, the beginning and end of the meeting. Thank you for your time. Thank you for listening to our concerns and our asks today. We really appreciate you coming to hear from key constituents about sickle cell disease and the policy asks today. And then again, refrain from joining the meeting in certain spaces. We are very well aware that we have an outstanding group of advocates that represent hospitals, clinics, schools, different caregiver entities. But please just keep in mind that we want to be as engaged as possible so that everyone can hear and be paying attention to this particular meeting. If you cannot attend or if something comes up out of emergency, please do not hesitate to contact us at engage@sickcells.org or across any of the other information and resources provided today to get in contact with the team. Next slide, please. So a few of the resources that are provided, again, right there on the resource and documents tab, but also as you'll see within the app, are different toolkits to prepare you for tomorrow. So this really great one-pager just gives you a quick infographic breakdown for tips for your Hill Day. Remember, a quiet meeting space, limit the distractions around you. Sometimes it's helpful to use headphones to reduce the noise and to magnify your voice. You will be on camera, so come camera ready with that bright smile and all that energy. Don't forget, have a bottle of water or a cup of tea necessary if right next to you to keep hydrated. You will have a couple of meetings, so just remember to have whatever you need close by to keep you prepared for the meeting. Keep a notepad or feel free to use the notes section in the back of your program book. And most importantly, be confident in yourself. As Ryan just shared, you are sharing your story, your voice, and without you, no change could be possible. So be genuine, be confident, trust us, you got this. Next slide, please. We've also provided you a really handy worksheet to share your story. It gives you kind of the steps to walk through like an elevator pitch for introducing yourself, describing a specific problem, giving a memorable experience or lived situation as it relates to sickle cell disease, whether you're a warrior, a caregiver, or any type of advocate, and then ending with that legislative ask. So this worksheet is actually something that you can take back with you to your community as you continue to talk about the work of the sickle cell disease and sick cells, as well as all these key asks that we're preparing for tomorrow. But if you follow the steps in the worksheet, you'll have exactly what you need to craft that quick, brief, concise story to share with your legislator before the other individuals go into those main key asks. So you will be more than prepared to have everything you need. Next slide, please. And now I'm going to turn over to Dr. Weeks to talk about your team leads and their roles.
All right, thank you so much, Melissa. Next slide. Oh, well, thank you. We were able to meet with some team leads from various states last week, so thank you so much. Oh, previous slide, sorry about that. Yes. So thank you so much for those that stepped up for that leadership opportunity. Team leads are essential in coordinating speaking roles during the Hill meetings. And so we want to think of yourselves as the facilitator. So opening up the floor, make sure that everyone has been able to introduce themselves, report any meeting details to the staff at the end of the meeting. And we would also task you with taking a screenshot with permission first, of course. And so we do this during in-person Hill days, as well to signify the important work we are doing. And lastly, engage with the offices via email or social media so that they know we serve as a resource and support system for them. Next slide. And these are just additional resources that we have. And so just make sure that when you're on the Advocacy Associates app, you can go to the Documents and Resources tab and get all of these downloaded, or you can also print them. And we'll also email you this information after this event, and it'll also be on the Support tab under the Zoom that you have on your platform. Next slide. And just a gentle reminder, do not record your meetings tomorrow. Just make sure you ask for permission if you are taking any pictures during the meeting or after the meeting with your phone or taking a screenshot. So just make sure you're asking for permission first. I know Melissa emphasized this earlier, but that's a really important thing for us to remind you all about. Next slide. We will also have office hours tonight from 4 to 6:30 p.m. Central. And just make sure that if you feel like you need support from us, if you want to practice your sharing your story, that worksheet is available to download or it's available digitally. So if you're able to, make sure you attend the office hours to meet with us. And you can also scan this QR code here to register for the office hours. So it's through Zoom, click the link and we'll be there. Thank you. Next slide. I'll turn that over to Melissa.
Thank you, Dr. Wheat. So we want to give you all a little bit of heads up about what the plan is for the breakout rooms that you'll be joining as soon as we have our closing remarks. So the breakout rooms are an opportunity for all the teams to gather. You will be led by your team lead or any of their assistants. Again, during these meetings, you're going to confirm your attendance for the Hill meetings tomorrow. You all can take the time to go through your schedules, make sure you have all of your speaking roles established as well. So as a reminder, you have a team lead, 2 personal stories if possible, 1 person per ask. Others will be non-speaking and observing roles and assist with taking notes. But be camera ready because you may get an opportunity to join in a picture. So the session breakouts are intended only for those that will be participating in the Hill Day tomorrow. So if you have not signed up for day 2, we understand that you may be absent from the breakout rooms, but feel free to stay on if you have any questions for the team. If you would like to observe, but you are not participating in Hill Day, just please join one of the breakout rooms in silent mode and feel free to take notes as well. But if you have any questions during the breakout rooms, the Sickle team will be rotating through all of the rooms with all the states represented to assist with any questions that may arise. And with that, I am going to turn it over to the team. And thank you so much in preparation for tomorrow's Hill Day.
Thank you so
we
much.
have a little bit of cushion time. Do we?
Yeah,
we pretty good so far, right?
We have some cushion time. We've been doing very, very well on these meetings. There are a couple of things that I wanted to just circle back on. The one is I think you guys did a really great job talking about sort of the do's and don'ts. We, of course, would love for you guys to get pictures, but of course, make sure you're asking first. This is something that we like to build momentum with. So for those of you who are returners, I know that we may have some folks who were on the policy forum last year and are thankfully coming back this year. You guys know that we use your pictures. Again, when you ask the staffer if you could take a picture, we use those pictures with your beautiful smiling faces to make sure that people could understand, like, hey, this is really important, right? In our social media as we're wrapping up the sessions. There's one thing I did want to point out, a quick little anecdote as to, why some of the meetings are important, but also the pictures are really nice. As we were going through the pictures last year, I zoomed in and I said, hey, this is a member of Congress joining one of these meetings. And sometimes you guys may have people who join a little bit late, right? Like you may not know who they are. One little quick tip that I like to share with people is that if you see someone join and they have a little circle pin on their lapel, there may be a member of Congress and they just may not even introduce themselves. So they may think that you already know who they are. And I can tell you, as someone who, again, has been in DC for nearly 15 years doing this work, I don't even know who they all are. I will walk past them every day and like, who is that? Is that a member of Congress? But the lapel pin is always very helpful. So you may have members popping in. The pictures are always really great. And again, what we really want to show is that not only are you guys active in the meetings, but that we have a big community behind us and that it's not just Sickle and my team and ASH and SCDA and some of the other organizations or some of the individuals who are coming to DC to advocate. We need people on Capitol Hill to understand that that we are representing over 100,000 warriors across the country, that we're representing the needs of the community and the caregivers and the advocates. And we need to, as I like to say, take the Hill by storm. And so part of how we do that is one, by having these really excellent talking points, but two, making sure that we can share the great work that we're doing that goes beyond tomorrow. And so those pictures are always really helpful. I also want to make sure that we, underscore please don't record the meetings. We like to give as many staffers as much privacy as possible in terms of the things that they're saying, but always ask for a picture. Okay, I think that's enough of me yapping about some of the things that, so the sort of the do's and don'ts of today. I would like to transition over back to our wonderful CEO and co-founder, Ashley Valentine, to give us some closing remarks. And again, we're going to do closing remarks before we get to our breakout rooms for the day. So hold tight, y'all.
Great. Thank you so much, Ryan. So this has been an exhilarating day. First off, thank you all of you for participating in Policy Forum. We really do this for the community, and we wouldn't have a Policy Forum without you. Also, I'd like to thank again our sponsors and our speakers for helping to make today possible. So today was very exhilarating and very exciting. We covered several important topics, including the important role that Congress plays in advancing care and support for people living with sickle cell disease and their families, and how advocates like you help to educate policymakers and discuss the realities of sickle cell disease. We also had a discussion about the Comprehensive Care Act and the critical role it plays in improving access to care for our community. We had an overview of federally funded sickle cell disease program and why sustained funding is important. And finally, we shared tools and resources. And we also discussed the importance of the relaunch of the Sickle Cell Disease Caucus. So today's conversations really highlighted how closely federal policymakers connect with all of you and your stories. So thank you again for participating. So that concludes our policy forum. We left plenty of time today for you all to move to your breakout rooms and start to practice and get to know each other. And the team will be here for any other questions.
Thank you, Ashley. I always appreciate your remarks. So we're going to move into breakout room sessions where you'll meet with your state team and prepare for day 2. Melissa from our team is going to share logistics for how the breakout rooms are organized. So please look out for your state and then head to your room. Melissa, I'll turn it over to you.
Thank you so much, Ryan. Next slide, please. So as a reminder, everyone has been assigned to a breakout room according to their state or region, so you may be combined with another state. During this breakout session, you will take the time to get to know one another. Your team lead will be introducing themselves, giving you all a quick rundown of how some of the practice and mock demonstrations will be going within your breakout sessions. And then you'll get a chance to share your story with one another so that you can start to identify who will be a great storyteller for particular legislators, and then who will be assigned as the 3 asks for each meeting. So remember, you're going to rotate your role. You'll have 2 storytellers, 3 asks, and someone to be the note taker and observe. Also keep in mind, it would be helpful to keep a timekeeper if you really want to control all the amount of stories and keep getting those key points within your ask. So just know everyone will have a role. But during the breakout session, as I mentioned, the Sick Cells team will be stopping by each breakout room to make sure that you all are prepared, answer any questions, or just check and see how some of those practice sessions are going as you're sharing your story and getting those asks in. So feel free to ask us any questions there or tap into any of the resources to reach us. Again, speaking of those resources, they are available right there in that little tab that says Documents and Resources, as well as on the portal. So if you're having any trouble finding them, please let us know as well. So shortly, you will see something pop up on your screen that assigns you to a breakout room, and it's according to your state and or region if you have a smaller attendance for your particular state. But please just let us know if you have any questions. And we are excited to see how you all are doing in breakout rooms with your stories. So get ready in just a few, grab some water, get comfortable, but do not go anywhere because you still have breakout sessions.